This Good to Go segment is sponsored by Spectrum Health Medical Group.
According to the National Association of Neurological Surgeons, an estimated 8 out of 10 Americans experience some form of back pain during their life. Fortunately, for 90% of those affected, the pain is temporary. It improves without surgery. Dr. Matt Carrick is an orthopedic spine surgeon from Spectrum Health, here to talk about back pain, its causes, and the treatment options available. Hi, Dr. Carrick.
Hey, thanks for having me.
I am glad to. Who is most likely to experience back pain and why?
So for better or worse, anybody can experience back pain. It is a very common diagnosis, as you mentioned. We see it all the time, and it really is predicated on the fact that we have lots of different lifestyle issues which can lead to back pain, such as our weight, our activity levels, the things we choose to eat.
At what point, because I know when I get a little bit of back pain, I always think, oh, I'll just, baby it a little bit, it'll go away. At what point should we be seeking help for the pain?
Yeah, great question. And so as common as it is, most people don't need to see their doctor right away. The things that we see in the hospital are people with severe back pain, pain which radiates down their legs, obviously anybody with trauma. The more common scenario is the chronic issues for which people see their primary care doctor, kind of that dull ache, it bothers me a little bit, seems to be changing my ability to do the things I want to do. So that's when they generally start with their primary care physician for some non-operative options.
You mentioned that trauma is one of the reasons that you see people. What are some of the other reasons that they are so severe that they're seeking you out?
People with big disc herniations, whether that's from lifting or not really doing anything specific, people with pinched nerves, people with any sort of other injury.
And tell me a little bit about the evolution of back surgery. How has that changed over the years? Certainly when you've been practicing and maybe even beyond.
Yeah, things have really improved from a procedural perspective, and our ability to get people in and out of the hospital safer, quicker, with shorter recoveries has really changed the spine surgery specialty. Our incisions are smaller. We're starting to use robotics. We have navigation. We get people up and out of bed the same day, instead of having people lay in bed for 5 days a week, which is what was done many decades ago.
Nice as you are, Dr. Carrick, I want to help people avoid having to see you. Do you have any advice for how folks can minimize the risk of suffering back pain?
Yeah, the best thing people can do is stay active, keep your weight down to sort of a normal weight. Try your best to eat the appropriate things, whether that's fruits and vegetables, and then just live sort of active physical lifestyle. That being said, even those people end up with back pain from time to time. And like I said, thankfully, a lot of the times you can avoid an operation. We're really sort of the end of the line for most people.
Yeah, that is a serious measure to take, right? The aftermath of back surgery is pretty serious stuff.
Yeah, it is something that I specifically don't take lightly, and no patient should take lightly either. Most people would like to avoid surgery, and most surgeons really only want to operate when there's an absolute necessity for the operation. So you're very right, and there's no such thing as sort of minor back surgery. It's all pretty serious stuff.
Big deal. Yeah. All right, folks, for more information, visit the spine and pain management page on the Spectrum Health website. We'll put a link to it on our site at 13onyourside.com. Dr. Carrick, thanks so much.
It was a pleasure. I really appreciate you having me.